There it is. I was like, I don't know what's going on. Ah.
That's fine. That's fine. Technology can be fabulous, but then when it, glitches or we're still figuring it out. So
I'm so sorry, everyone. Thank you for joining. My goodness.
no, I'm so glad. And I know that it's a busy day and it's the end of the day, but thank you for sharing your time and your expertise with us. We really appreciate you.
Oh, of course, of course. I'm just excited to chat with everyone. This is so exciting.
I know. Okay, so thank you guys out there also for helping us, specifically Kim and dietitian Sherry and everybody else. We appreciate you guys. So before we get started, I've asked UC, I'd like to have our viewers learn a little bit about you. So if you can tell us a little bit about your background. You have a really special background, and I want everyone to know about it.
Absolutely. Okay, so I originally grew up in Dallas. I'm first generation American. My parents are Nigerian. And I went ahead and did my clinical doctorate in physical therapy at University of Chicago. And the only reason I became a physical therapist was to do pelvic health stuff. I had no idea. I knew about sexy time, but I didn't realize that I wanted sexy time to be the primary driver of my PT skill set. And so then I went ahead and did a residency in pelvic health at Washington University. And it was then that I was seeing patients of all genders, really, where I was learning about, wow, I'm treating all these sexual issues or these pelvic health issues, but they also have a lot of sexual issues. And I wanted to learn more. So I went ahead and did a sexual health certification program through the University of Michigan, where I became a certified sexuality counselor and educator. And so now I am assistant professor at the University of Texas, Dell Medical School in Austin. I'm also the clinical program manager for the pelvic health program at UT Health Austin. And I'm founder of UC Logic. And I'm here today with you all, gonna sip on some bourbon and answer some questions. So I'm so excited. Was that helpful?
That's wonderful, wonderful. Thank you for sharing your background. I appreciate it.
Oh my gosh, thank you so much, Jeanice. You're the bomb.com, and I am so honored to be a part of your professional circle.
Yes, well, you have my heart, so I love watching your posts. I look forward to your energy. I mean, it's just great. So thank you for everything that you're doing to advocate pelvic health and sexual health for all. Right?
Yes, absolutely. For everyone out there.
Yes, absolutely. Okay, so we have a lot of questions, but I was thinking that before we dive into the specific questions, that we could just give an overview of pelvic floor and sex and orgasms, just a little bit of fundamentals for people that may not have any idea how things work. Okay, so it doesn't need to be deep clinical level, easy peasy.
Absolutely. So give me a second, guys. I'm just gonna grab two models just to quickly show you guys really quickly, two shapes.
Welcome, everyone. We are talking about sex and orgasms. I'm going to see if I can pin this on here. I don't know. I'm still learning things, too. Or maybe you can't pin it. I don't know. Okay.
Well,
cool. But you're here. We're good. So you got your models.
Okay. I brought my model. So we're going to start with the female pelvis, okay, right here. So the pelvis, right here, everyone's familiar with that. The pelvic floor is muscles at the bottom of the pelvis, right? And their primary job is to hold the organs inside of you. They help you with urination, defecation, sexy time, and babies if you have a vagina and a uterus, right? If you have a male pelvis, ooh, this thing is heavy.
Wait, you have these in your house. I just want to be
clear. Yes, I do. Coffee table, on the coffee table. That's with awesome. A sexy time book for everyone reading and enjoying.
Pelvises with pelvic floors in our house.
Absolutely. So here is the male pelvic floor, right? So you see the male pelvic floor is going to be similar to the female pelvic floor. It's going to be anchored to the coccyx, wrap around the anus, come up through the perineum, and comes up onto the penis. Okay?
Yep.
Now, when it comes to orgasms, because I know everyone wants to talk orgasm, which is my, one of my favorite things. It's in my top five, right? So people want to know, like, what is happening physiologically when we have an orgasm, right? And so there are a lot of things that are happening physiologically. First off, what's obvious is that the pelvic floor muscle is supposed to be contracting and relaxing. So it's going to be doing this type of thing, or for some people it does this. Right? For some people, it does this type of motion, right? You're also going to see an influx. You're going to see a vasoconstriction. So you're going to see blood vessels constrict and stop, right? Because they're holding in that blood flow, and then they're going to release it, right? And then you're also going to see like increased nerve activity, because all the pelvic nerves and the pudendal nerves and all of those nerves are going to be really, really active during an orgasm. Now, one of the things that I want all of us to kind of sink our teeth into when it comes to orgasms is, yes, there is a very much a physical component to it, right? The pelvic floor is a strong component. If your pelvic floor is either too tight or if it doesn't have enough support, your orgasm quality might be different. But another thing that impacts your orgasm quality are the other factors, like psychological factors, right? Environmental factors, hormonal factors, pharmacological factors. So all of those things are what can impact your orgasm. So sometimes when my patients and clients come to me and they're saying, I just need to have like a really tight vag, or it used to be way tighter before and it was way easier to have orgasms and now it's not. And I say, okay, well, we're going to work on your pelvic floor and we're going to make sure that your pelvic floor is active and functioning properly. But we also want to make sure that those other components get as much attention as your pelvic floor, and we can address them the way we need to. Oh, it looks like Jeanice, your screen changed.
I don't know what happened. I was pressing buttons and waving at people, and I pressed something. I'm still like learning things. So there you are. And here is so that's my backyard, everybody.
Oh, I love that.
It looks like I just reversed my screen. Here I am.
There you are.
I'm going to keep, I'm trying to wave at people and kind of manage questions and things. So if you see something crazy happen, I'm still learning, and just be patient.
That's totally fine. That's totally fine.
Yes, good. So one thing I think it's important also to note with the pelvic floor and orgasms is that isn't something that we're actually having to think like, oh, squeeze. This is an automatic rhythmic thing that our body.
So yeah, sorry for the noise, y'all. But that is absolutely right. This is an automatic thing. That's an autopilot, right? And another thing for your orgasm to be functioning properly is your nervous system needs to be intact, right? So if your nervous system is a little bit out of whack, right, those automatic things that are happening, like the blood flow, the muscle contractions, all that doesn't really happen the way that it should.
Yes.
Right? Doesn't happen the way that it should. So you cannot will yourself into an orgasm, right? We have to almost kind of set up an environment to where the orgasm is just it's just a very hospitable environment for your orgasm to just wonderfully appear.
Right. Good. Oh, yep. Okay, so you guys, we're going to go through the questions that we got in the story, but as we're answering questions, if you have questions that come in, please just feel free to write them down, and we'll try to add them in as we're able to. So we talked about this some in the sticker question, but how do overactive pelvic floor muscles affect sex?
Absolutely. So when we're thinking about overactive pelvic floor muscles, let's think of it from a painful overactive pelvic floor muscles and non-painful overactive pelvic floor muscles, if we can. So if we're starting with a person who's experiencing pain and they have a lot of tightness, first of all, your amygdala is kind of the center of fear in your brain, right? And so if your consistent experience of penetration and tight pelvic floor muscles is like, stranger danger, your brain is already prepping you and like almost like orgasm blocking you.
Yeah.
Because it's like, oh, this hurts. And so then your muscles are going to stay contracted.
Right?
Exactly. It's almost like, nope. So when you have an overactive pelvic floor and the pain process is coming, then you have not just the physical contraction of the muscles that's causing discomfort. But then your brain is now in that rhythm, and it's saying, okay, penetration is happening, pain is coming, this is not a pleasure place. So it's very hard to have an orgasm with that pain and the tightness component.
Yeah. So you have
right?
the mental and the physical.
Right, exactly. And then also too, when you're thinking about a contracted pelvic floor or tight pelvic floor, it's just like our fists, right? So if I keep my fists clenched all day, there's going to be poor blood flow into my fingers, right? If I keep my fists clenched. There's also going to be a lot of compression of nerves to help me with hand function. And so the same thing happens with your pelvic floor. If you're clenched all day, you're going to have poor vessel nutrition or vascular nutrition, which means that your muscles aren't getting what they need. The nerves are being squeezed, holy heaven, right? And they're being compressed and you're not getting the good feedback. So your sensation is off. Whether you might have numbness or you might have hypersensitivity, which isn't always pleasurable. So that's where the hypertonicity can be a problem, even if you don't have pain.
Right. And then you also have, so the pelvic floor is meant to shorten and contract and then lengthen and let go. And you need that play in there. And with overactive, you're not getting that. So awesome.
Exactly.
Yep.
You're just kind of stuck. You're just definitely stuck. And also too,
your hand work. Like if you went to go try to write
exactly,
could it do the jobs that you need it to do?
No. And this is also and this is an important concept for my penis owners out there as well, because that can also impact a person's ability to achieve an erection or to maintain an erection, right? Because erections, similar to clitoral engorgement, when we're getting aroused, right? And we'll talk about that in a second, is all about blood flow. And if you are, kind of blocking your muscles' ability or that area's ability to get blood flow to the area, it's like,
Yeah. Because so in males, the pelvic floor actually surrounds part of the penis to help keep blood flow there. And
absolutely.
Yep.
Absolutely.
So I think this is a very interesting one. What does an orgasm feel like?
Gosh. Now, if you poll 20 people, they are all going to say something a little different. Right? So I always say, like, I will tell you this, that people are going to say that they're feeling a release or a buildup of tension. They're going to feel euphoric. They're going to feel almost a separation from their body. They're going to feel, excited, tense, floating. All of those emotions, right? They can range. And then some people with an orgasms, they can be almost like a muted orgasm. Like it's almost like you put a pillow over your mouth and you're like, whoa. And you're like, that was it, and then the next orgasm you have is like
person to person and also within the same person. So you might have one type of orgasm. And
right.
Well, I would like to, I'm going to show this. I'm going to read, this is this book. I guess, you can't really see it there, can you? Well, it's a book called, oh man, now let's see. All right, am I back? Oh.
Huh? I'm back. I just was.
No. I'm back to the pool. Okay. So this book, it's reversed. I was trying to be fancy and take a picture of the book before the Instagram live so that I could scroll through and show people the book without it being reversed, but I wasn't able to. So this book is called Female Sexual Function and Dysfunction. And this is a really long explanation, so I'm just going to read part of it, but here is their definition. Orgasm may be defined as a variable, transient peak sensation of intense pleasure, creating an altered state of consciousness, which is, sometimes true. And then something else they say, there's rhythmic contractions of the pelvic musculature. So I thought that was really nice. And then an induction of well-being and contentment. So
yes,
a good definition.
And I have another great book. It's the Orgasm Answer Guide.
Okay, good.
And this is written by one of the authors is Beverly Whipple, who's a world-renowned researcher on sexual health and orgasms. And I love this book because it's super patient friendly and it breaks it down and it has literally all of the questions you can ask about sex or orgasms. It's in this book and I love it, love it, love it. And
Is
I
it
have
on
my
Amazon?
It's on Amazon.
Okay. So after our live here, if you could send me a picture of it and I'll put it in my story so everybody can see it. And
Absolutely.
I'll put maybe an Amazon link there too if you want to go get it on Amazon. But that's
absolutely.
Of course.
Absolutely.
Okay. So next question, does having a strong pelvic floor muscle help with orgasms?
Of course. Of course it does. You know, and I say it like that because there, like I said, there are multiple factors that influence your ability to achieve an orgasm. And having a strong and coordinated pelvic floor.
Exactly.
A coordinated pelvic floor,
you do the right thing at the right time.
Exactly. Is going to be a great foundational component in order for you to be successful in having pleasurable, and I'm saying pleasurable orgasms because all orgasms are not pleasurable. Right? Depending on the content, huh?
Yeah.
Depending
tell me more about that.
Yeah, depending on the situation that people are experiencing an orgasm, the orgasm can be an unwelcome.
So you have an orgasm with an unwanted sexual encounter experience.
Yes, and that is not a pleasurable orgasm. So when we say it's a subconscious autopilot thing, it's a physiological response to stimuli, whatever that stimuli might be, right? And in a sexual
perspective, I had never really even thought about that.
Absolutely. So I always tell people, because particularly this is important for my colleagues and friends out there who have persistent genital arousal disorder, where they always have a lot of orgasms, but they're not pleasurable, they're not welcome, and they're not happening at a time where that person would like them to happen. And so that's another important component to keep in mind. Yeah. But having a strong pelvic floor is foundational in order for you to have good orgasms.
So I would like to just interject something because I know that there is some dispute in the research in terms of pelvic floor muscle training actually make your orgasms better? Does it actually make sex better? So looking at the anatomy, the pelvic floor in females actually attaches right there on the clitoris. So when you're squeezing, you're compressing some, and it's held with the erection of the clitoris. So even though all of the research may not show what we believe, there is some good research. And do you have anything to add on that?
No, you're spot on. There's a group of people that say that pelvic floor strength is not a foundational component for orgasm function, which I would disagree. Right? I would disagree. I would think that if we looked at if you look at some of the samples of the people that they studied, those individuals also had some other psychological components involved. Right? They were having some pleasure and satisfaction problems going on. So there may have been a psychological component that was being missed. And if we're just looking at the physical, like I said in my bourbon tales, if we're just looking at the physical, right, then they're going to say, well, Kegels alone aren't going to make a perfect orgasm. It's like, I agree with you.
Yeah, exactly.
Right? But at the same time, if you have an individual who has all of those other components are well intact, they have great relationships, they're very much aware of the sociocultural influences, psychologically they're intact, but their pelvic floor is profoundly weak, that's a situation where increasing the pelvic floor muscle strength and coordination can actually do a lot for a person's sexual response and experience and their ability to achieve orgasms.
Yep. And I know we're getting off topic. Well, not really off topic, but off the question. But there's also some really good research to support that by addressing some other dysfunctions, whether it be urinary leakage or pelvic organ prolapse, that can improve female sexual function as well. So there's a lot of good evidence to support it, but we need more. And we need to
Yes.
apples to apples and all factors being the same, and that's almost impossible. So
Yes. Yes. Yes.
good. Okay, so any tips? I'm going to just jump into this. Any tips to have multiple orgasms? Because that came up at least 3 or 4 times. How do we do that consistently?
So this is the thing.
Woo!
I know, right? I'm like, oh gosh.
I'm on a white sheet.
You're getting a little flushing response. So here's the thing about orgasms. Women do not need, or women, people who identify as women, vagina owners, uterus owners, do not need a huge refractory period. They do not need a huge rest period. So one of the things I always tell people, if they're, and mind you, I don't always tell people to have goal-oriented sex, but these are things that if you want to experiment sexually, because orgasms are like a dog running away from you. The harder you chase it, the harder it's going to run away. So don't chase that. But I would say go into but it's so true. It's like, I need to have an orgasm. And then it's just like right there, but right out of your reach. So I would just frame this in the context of to explore yourself sexually with you and your boo. I would say this, don't rest as much. Like after you have an orgasm, have your partner stimulate another area of your body that kind of brings on some sexual response. So an erogenous zone, like especially if they've been working on your clitoris, don't have them jump back into the clitoris. Have them massage the vulva or the nipples, or get a nice external stimulation toy, like one of the great toys from Dane Products, to like kind of start the vibration going so that you can start to get that sensation back. Your partner might need a break, but you do not. So continue to stimulate that. And as your partner stimulates, then you can like actually be like, you know what? Yeah, I can do this like right away. And then you see like you just had your orgasms is happening, and then it's just kind of doing this, and you can let it come down, but not all the way. Don't let yourself totally recover. And then have it come back up again.
So you mentioned in the story last week a couple devices. I think, you have a lot of information. So do you have anything close by that you can show us right now? And then I'd also like to post that in my story so that you guys can click on a link and go look at some options that UC is recommending.
Yeah.
And you guys...
trying to find it.
No, you're good. If you have any questions that you'd like us to talk about right now, just jump in and send them to us. We have a list of questions, but you guys are here, so we want to answer. You have questions too.
Okay, so the first thing I'm going to show you is fin. Okay, can you guys see this? This is the fin.
Okay.
And it's the bomb.com. This is from Dame Products. DAME Products. And I love this. You see this?
Yep.
It's awesome because it can fit on your finger and it has different speeds. So you can apply this like at the pubic symphysis area to kind of help improve blood flow to the area, right? You can apply this to the clitoris.
Right on the clitoris. We might want to
Right, to the side here, in the vulva. You can massage the nipples, the inner thighs. This feels really great on the inner thighs if you start at the knee and slowly work towards the perineum. It can actually feel really, really great. And these are awesome products because you can see it doesn't look like a sex toy, right? Like if I have like a neck problem, I can just put that right here. It doesn't look like that. So it's not as intimidating for those of us who are not super comfortable using toys. And it's also detachable, so you don't have to use that little thing. It can just be like this. Okay,
so that's on Amazon?
That's a good, I go on dameproducts.com. I do not know if they're on Amazon yet.
Okay, that's fine. You guys will post links and tell you where to get them.
Okay.
Good.
And this next one is called the Squish. This is from Unbound Babes. And all you would do is you squeeze it, and it gives you all of the stimulation you need. And you can hit the middle part, and it'll give like all types of stimulation. And what I like about it too, it doesn't work. Yeah, you just squeeze it, and then it vibrates.
Okay. And then the harder you squeeze, the stronger it vibrates?
Yep. Mm-hmm. And it has many different settings. And what I like about this, again, it's not super intimidating. It doesn't have to go inside of you. You can use it on yourself, on your partner simultaneously. And plus it's super fun, you know, and all of this is really nice silicone. So it's not a cheap plasticware.
Yeah. So it's good. Okay.
And
great.
Last but not least is the bender. So this guy is awesome because it can you can literally lay it on your stomach and then down towards the vaginal opening. Isn't that cool? Or you can put it inside of you if you want. And then you have all the controls, let me see, like right here. And we'll turn it on.
And so is the whole device vibrating?
Yep, the entire thing.
Okay.
The entire thing.
Levels of vibration.
Yes, yes. Now, I'm not a brand ambassador, so I don't know exactly how many speeds it has, but it has at least 8.
Wow.
But yeah, all of these are pretty amazing, well-engineered tools, and I love both of their websites. Dame Products and Unbound Babes are both female-owned, founded companies, and they have great resources about sex and sexy time. They have great blogs. I know Unbound Babe has like a sex horoscope, which I always love reading, you know, so it's a great resource to make sex fun.
Yeah, I imagine the packaging is going to be subtle too. So if you order something,
packaging is
it's not going to be like, here's your vibrator.
No. The packaging is subtle and really pretty. Like Unbound Babes, they put it in this mesh package for me, and it just said Unbound, and it was really nice. I really loved it.
Good.
Yeah.
That's beautiful. Okay, so we'll post those later. I'm going to jump into a question here. I have pain when I'm aroused before any penetration happens. Any advice on stopping this? Yeah,
so first of all, I always tell people this, that when you're having pain, did that glitch? Okay. When you're having pain with arousal, the first thing you want to understand is where are you feeling that pain? Are you feeling it in the clitoris? Are you feeling it in the vagina? Are you feeling it in the rectum? Right? And then if you're getting pain with arousal, I want you to kind of stage your arousal, right? Is it with immediate arousal? Or is it physical touch? Or is it with emotional or psychological arousal? Right? If it's more with physical touch, I always tell people to start in a non-sexual part of their body, right? And actually using the help of a toy is going to be great in terms of feeling the presence and feeling the pleasure in that area of your body versus kind of jumping into, oh, I'm about to have sex. Just working on staying present with that. Now, if you're starting to get pain when you just start thinking about sex, then I would employ the help of an amazing sex therapist that has experience with working with people who have pelvic floor dysfunction, right? Because sometimes, for some of my clients, that pain with arousal occurred because there is some type of emotional block when it comes to being sexual, right? Now, if you definitely don't have that emotional block and you're like, listen, every time I get aroused, I feel this shearing pain, then it may be that your pelvic floor is starting to contract, right? And so working on actively doing some pelvic floor relaxation techniques like diaphragmatic breathing or getting into a child's pose or being on your back with your knees at your chest, positions that promote pelvic floor muscle lengthening. And then if you're partnered, having your partner stimulate you or arouse you while you're putting yourselves in that position can actually be a really great start.
Good. Excellent. Great tips. So if you have any more questions, just send them in, but hopefully that answered your question, and that was super informative. Thank you.
Okay. Perfect. Good. But let me know if you need me to add more to that.
Okay. Next question. I have orgasms while working out at the gym. What do I do?
Well, oh gosh, I love the gym. Yeah, I know. I'm like, wait, what are you doing? So I want to add on and be like, what exactly? Yeah, I want to know what this person is doing at the gym, like what movement, because you know what I mean? So
yeah,
I'm not sure.
Is it an adductor machine where you're,
yeah,
pressing or, yeah.
If
or
you can,
lying on your stomach doing some cobra kind of thing.
Right. Exactly. If you could give, was this a live question?
No, this was not a live question. I'm not sure who asked it. So if you're out there, we would, and it was a couple people that said working out. One was the gym and one was working out. So I don't know who they were. So if you're out there, or if you see this, or you know somebody, DM us, and we want to connect with you and learn more.
Okay, well, I'll just give a general answer. So that's actually a multifactorial thing, because I've had a couple of patients and clients with that ish. So I'm just going to address it from a global standpoint. Number one, when you're exercising, sometimes people, that is their happy place. That is their pleasure place. So when they're exercising and feeling good and letting go, and they might be jogging, or they might be doing some abdominal crunching, or they might be doing some squats, and they're actually contracting their pelvic floor. It's a combination between releasing those endorphins, feeling really good about themselves, maybe feeling a little sexy about themselves, and then engaging their pelvic floor muscles at the same time can create an orgasm experience.
Especially since the pelvic floor connects to the clitoris, or at the base of the penis, right? And you have that anatomical connection there.
Absolutely, absolutely.
There's nothing wrong with it.
Absolutely. But I totally get it. It can be a little embarrassing if you have like a, toe curling, angels weeping type of orgasm at the gym, and you're just like, OMG, I just had a loud orgasm, and you don't want that to happen. So I would say deconstruct the movements that you are doing when you get an orgasm. So if it's, like Jeanice said, is it when you're doing an adductor machine, or things like that? Try to minimize those activities in the gym and really focus on activities that promote openness of the pelvic floor while still stabilizing the other parts of the other muscle groups that you're trying to strengthen.
That's good. That's good.
But I would love to get more details.
Yes. Yes.
They're better.
I agree. Pain with deep penetration only. So what can they do?
Sure.
And I'm assuming it's vaginal penetration, but
okay. Okay. So we're assuming it's penetrative sex in the vagina, penis, or toy. So when we're thinking about deep penetrative sex, again, there are many reasons why people have this. There could be some scar tissue, it could be endometriosis, but from a physical therapy perspective, typically it's either because your obturator internus muscles, so the side muscles of the pelvic floor, are being strained. And so that muscle is responsible when we're crossing our legs. Like, I know a lot of people cross their legs at their hips. It's that muscle is being kind of left in a lengthened and strained position. So I always tell people that when you're sitting, first and foremost, try to man spread. So don't sit with your legs crossed if you can.
Did you just see me uncross my legs?
Yeah, I did see. I saw the adjustment where you just man spreaded. But that actually puts your pelvic floor in a relaxed state, because think about it. If you're always crossing your legs and clenching your belly and clenching all those things, it's like a physical microaggression to your body all day long. And so by the time you have sexy time with your partner and you have deeper penetration, it hurts. Another good exercise would be the abductor machine, so the machine that you kind of spread your legs apart, because it focuses on strengthening your butt muscles, and it kind of gives your that side wall muscle, the obturator internus muscle, a little bit of a break. You can also achieve that by getting a TheraBand and tying it around your knees and just spreading your knees apart, and then relaxing and spreading them apart. And then with your knees spread apart, what you can do is you can take a nice belly breath and feel your pelvic floor open up and release. And then you exhale and let your knees come together. So that's a great way to practice that. But if you want a really quick, helpful thing, Nutco is a great company where they have these tools where you can put it on your partner's penis to limit the depth of penetration, or you can get in positions where you yourself control the speed and the depth of penetration. So I always recommend being on top if your partner has a penis, or if you're using a toy, you have to be on top, or being on your side. It's much harder to deep penetrate when you're on your side. Mm-hmm. And doggy style is definitely not the best one for you, because that is the one where they have full control of the speed and depth of penetration. So I would minimize that one. And if you need to modify it, if you just got to have it doggy style, then don't do it on your hands and knees. Just bend over the kitchen counter, and that will be a much more comfortable place to do it.
Very, very, very helpful information and really relevant tips that people can take right now and use them.
Yeah.
So thank you. That's awesome.
No problem.
Okay, I have pain when my OB or Urogyne inserts anything vaginally. However, have never had sex. She has vulvodynia and she'd like to have sex one day when married. Anything that you would suggest in advance of that? What are some things that she can do to start preparing her body?
Oh, well, okay, my friend. So without knowing you very well, so I hope this is not too invasive, but I would first start by kind of doing what you're doing now, getting some sex education, right? Educate yourself about sex and sexuality and understanding that being sexually active is not only based on penetration. Penetration is not the gold standard of sex, right? And your orgasms are not genital dependent. Okay? They're not. They're not. Pleasure is going to be like an evolving process. It's not static. Your sexiness is not a static process. It's a fluid process. So as you learn more about your body, that is going to be the most important thing. And thinking about, and I don't know what your comfort level is about masturbation, but I always tell people that masturbation or self-touch, if you prefer to call it that, is the best randomized control trial you can do on yourself. It is the best research project.
What works, what doesn't?
Right? Because then you know what works. You can start to body map yourself and figure out what are the parts of my body that I am comfortable touching and getting pleasure from. And what are the parts of my body that I am comfortable touching but not so comfortable getting pleasure from, right? Because you might be comfortable touching your vulva, but you may not be comfortable getting pleasure by touching your vulva. So first do that type of assessment on yourself and see where you're at. And if you're like, man, this is a lot of stuff that I need to unpack and I might need some help, then I would totally suggest working with a sex therapist. Or if you just want sex education and a little bit of guidance, you can work with a sex counselor like myself, and I'll explain the difference at the end.
Okay, good.
Where we can guide you through and tell you, okay, like here are the steps we want to take. But then I'd also suggest working with a pelvic health physical therapist if you haven't already, to make sure that we can help learn to train, like re-educate your muscles on how to contract, relax, lengthen when you need them to do so.
Mm-hmm. Yep, and some self management tips for vulvodynia, and that's our ultimate goal, is to be able to give you
Absolutely.
the tools so that if you have a flare-up or something happens, you know what to do to help those symptoms. And it's a powerful position to be in, right? To be able
Absolutely.
to help and to know.
Absolutely.
Because it's really terrifying to have pain or to have symptoms and you feel powerless, you don't know what to do, you don't. There's so many things happening to your body. So we want to empower you. We want to give you knowledge and tools to live your best life, right?
Absolutely. And, do what makes you sane, my friend, right? And also don't put pressure on yourselves to like kind of have, penetrative intercourse. If the goal is that you're like, hey, I would just like to go to the doc without it being painful, that's a great goal to start with. And then you can kind of work on your own sexual development as time permits. But do it on your timetable.
And then if you have any other questions, feel free to DM us, but I love that. What about right now? Why don't you tell us, because we're very close to the end. I feel like some of these questions are a little bit repetitive. So
okay.
The difference between the different types. Mm-hmm.
Sure. So
and also how to find someone.
Sure. A sex therapist? Okay, great. Okay, perfect. So first and foremost, a sex therapist is not a protected term. So basically anyone can call themselves a sex therapist. But what I want you all to know is that a sex therapist is a mental health provider only. That is the only person that should be calling themselves a sex therapist. And a certified sex therapist is a person who's taken a bunch of didactic training specifically on sexual health. So a sex therapist has graduated with a master's or PhD in social work or licensed family counseling. So they know how to do mental health care, but then they do added training for sex therapy. And so if you want to go to a sex therapist, typically they're going to work with you if you have a history of trauma, or they can get into the deep-rooted psycho-educational and psychological therapy, right? Mm-hmm. A sex counselor is someone like myself or Jeanice. It can be a doctor, it can be a clergyman, it can be a nurse. It can be a healthcare provider who provides a patient with permission. So they're going to ask your permission to discuss sexual health. They're going to give you limited information and specific suggestions in order to get through to get you through your sexual issue. Now, typically, you're not going to work with a sex counselor for long, right? You're not going to work with a sex counselor for a year. You're not going to do it. If typically, for me, I work with my clients around 4 sessions, 4 to 5 sessions. And then if they're not progressing, right? If they're discovering that there's some deep-rooted psychological stuff, that's when I graduate them and I bridge them to sex therapy. But they're going into sex therapy a prepared person. Right? Because they've learned all that stuff. Mm-hmm.
Yeah. Good.
Yeah.
Excellent.
And a sex educator is just going to give you just straight up education. Okay.
So when we are giving our clients and patients information about sex, it's very, it's, for me, it's overlapping with my pelvic floor. It's all, together, right? And so our ultimate goal there is the same as we were just discussing, to give you tools. So
yes,
this isn't going to be something where you're going to see us every week for a year, right?
Right. Exactly. And you would find a sex therapist through aasect.org, aasect.org.
Okay, good.
Mm-hmm.
Thank you very much. All right, we're nearing the end of our time. So we're going to take the question here from Liz Lebeth, and then we have one more in our story questions. So we'll take the story question first. So nervous about sex after baby, the first time is coming up. So do you have any suggestions for new moms that have just had a baby?
Yeah, absolutely. So first off, for new moms who just had a baby, you're a badass. So congratulations. But also know that your body has gone through a lot, right? And understanding that your body has transitioned, therefore you need to change your expectations. And I'm not saying lower them, no, but don't expect your orgasms to feel the same that they did before you got pregnant, right? What you want to do is you want to actually just kind of expand your definition of pleasure, expand your definition of what you want your sex life to look like, right? And add to it. And I always tell people this is the perfect time to do a pleasure map with yourself and with your partner. Relearn what's going to feel good to you and what doesn't feel good to you, because what felt good to you 9 months ago may not feel good to you right now. The way you want your partner to touch you, to look at you, to hold you. Because like I said before in my stories, you're engaging with yourself sexually in a different way as a new mom than you were not a mom.
And your body has changed. It's been
your body has changed.
Amazing journey, right?
Exactly. And you have to give yourself a minute to really get into that, right? Get into your sexy self. A lot of times, though, the nervousness comes when people say, oh, am I going to tear myself? Am I going to hurt myself? Well, that's when you're going to kind of talk with your partner and say, like, hey, can we stage this? Can we just use fingers or a toy and see how that goes first? Can we just see how I do with clitoral stimulation? And that's going to be great because it's going to be super empowering, right? Because you're going to get your self-efficacy back. Be like, oh, yeah, I can have an orgasm and be fine. Take it slow and then stage it up from there. But be honest with yourself and communicate with your partner, right? You're in it together.
Yes, very good. I would also add that don't think that your orgasms and your sexual function can never return to what it was pre-pregnancy. So initially, and even for a period of time, you may have some changes, and you may have changes forever, but it may even get better. So exactly.
Oh, that is a huge point. Thank you for saying that. Thank you for saying that. Because a lot of women say, I'm never going to have an orgasm again. It's always going to, no, it can be even better. It's just that I think people get so stuck on what it used to be that they don't want to be present in what can be.
Yep. Good. Okay. Here's the question. Recently worked through hypertonic pelvic floor. Sex is now free. Yay, but not yet pleasurable. How do I bring my brain around to not anticipate pain and be more mindful towards sex?
Ooh, I love that you saved this one for the last. Okay, here, first off, hold on one second. I have another book. Hold on.
Okay, good. And then Rachel, I see your question there. I would like, we'll answer that in the story question. So I'm going to see if I can take a screenshot of that. And we definitely want to connect with you. Very, very good.
Okay. So this book, I know you guys can't see it, it's backwards. It's called Better Sex Through Mindfulness. This is by Dr. Lori Brotto. I find this to be one of the most comprehensive books, particularly for people who have pain, who used to have pain with intercourse, don't have pain with intercourse anymore, but are struggling with pleasure. Because a lot of the research and a lot of the facts go with mindfulness, right? And how do we stay present in the moment? Because your previous experience with sex has been associated with pain. And you're like, I need to figure this out. So what I would first suggest is like have this book as one of your baseline books to read. But then in the meantime, what I would want you to do is really, like I said before, deconstruct your sexual play, right? So when you're talking about arousal, right? During arousal, are you able to just enjoy that arousal phase? Are you able to enjoy it? Or is it feeling good to you? Right? I always say that this is actually a perfect time. Sensate focus is when you're touching your partner for your pleasure, for their pleasure. You're not communicating to each other during this activity. So what you're going to do first is you're going to talk to each other about your boundaries, right? No penetration should be had. And maybe you guys can decide to take genitals off the table, right? You tell your partner what your boundaries are, they tell you what theirs are, and then you're going to blindfold them. And you just explore their body with your body or however you want to for your own pleasure. And that allows you to have some mindfulness in what your body desires and what your body needs and what the feelings you like. And then you switch turns. And then your partner does the same thing.
Sensate focus.
Sensate focus. S-E-N.
Good.
And your partner can do the same. And then at the end, you both can debrief and say, man, you can say, I really loved it when I was pressed. And they can be like, oh my God, that was amazing. And then they can talk to you about their experience being touched and your experience being touched. And then from there, it can really be about pleasure versus penetration. You can explore pleasure without the fear of anything, knowing that they're going to respect those boundaries. Because
Good. That's beautiful. That sounds like a very fabulous exercise.
yes, and there are a ton of great mindfulness exercise out there, but that's one that I just really love for patients who are in your situation, and I think it would be really helpful if you're partnered.
Good. Okay. Well, so Rachel, we're going to get back with you. We'll probably post something on our story and maybe DM you directly, but thank you so much for asking the question and joining us. You, as always, thank you for your time. I mean, just everyone. She was teaching a class this weekend in Michigan. She's working full time. She's juggling all my story questions and everything. Lunch break and her breaks. And so I know this last few days with me has been intense, and I want to tell you how much I appreciate it. And thank you on behalf of all of the myPFM family.
It is my it is my absolute pleasure, and I love doing these live sessions. So like it's been fun, and I hope at the very least that would make you so happy.
Yes, yes. Thank you guys for joining us. This will be available for 24 hours on both of our stories. All right, take care, everybody. Have a good evening. Bye-bye.
Bye.